My dear friends, now happy to see you again. In continuation with Dr. Priyanka, Z team, hair transplantation team, she was answering what are the common questions. In continuation, Dr. Priyanka, some more common questions, what the patient will ask and what is the answer, please.
Okay. So the other common questions which they ask us is, how long the transplanted hair would last for us? Is it permanent?
Yeah.
This is the very frequent questions that's been asked, and the answer to that would be, see, we are taking your own grafts and we are replacing it in a newer area. So it is just like your any other normal hair. It is not something new, or it is not something synthetic or artificial that we are placing in a new region or implanted in a new region. So you have to understand, whatever your normal hair is going through, even your transplanted hair will go through the same. So you can't give a certain amount of time that this is how or this much time your hair would last. So it's just like your normal hair. If you're going to maintain it properly as per the instructions given by the doctors, it is going to last as much as possible. So we will put you on certain medications, not oral but topical medications. We'll give you some multivitamin supplements, and there are few injections which will rejuvenate or enhance your hair grafts that has been placed. So all this together as a maintenance protocol, if you're going to do it and be consistent about all these procedures and medications, it is going to last very well. Not just the transplanted hair, even the hair which is existing in your head already is also going to have a good result if you're going to maintain this properly.
Yeah, I understand. Like anything you maintain properly, it will last as if your normal
Yes.
hair is there.
Yes.
Okay,
Yes.
doctor. What is the next question, doctor?
So next common question would be, after the procedure, how much will the pain threshold be? Can I bear the pain? Is it very much, is it too much for me to handle? And they tend to see a lot of YouTube videos and they'll ask us a lot of questions, because YouTube videos shows everything nowadays. So it's like they tell us, I'm very scared, ma'am, after the procedure. I see videos where the patient's face is swollen and everything. Of course, the patient will have some swelling. It's just that we put a tight band-aid on the forehead where the swelling will not seep into the face. That is the difference. So we, according to the, complications, we also give you medications. We put you on antibiotics to avoid any infections. We give you painkillers. All these are just for 5 days. So everything that we are doing, almost the second day after the procedure, most of the patients are 85 to 90% comfortable, sir.
Okay.
They'll have a mild swelling in that area, for which again they'll be on medications, and it will subside very soon, and you have to clean it, follow up, do proper dressing. Only then it will go very smooth. It's a very simple process.
Okay. What is any other common question, doctor?
So the other common questions would be, how important is my medical history? I'm a diabetic, I'm a hypertensive, can I do the procedure? So medical history is very, very important. For like any other surgical procedure, all your medical parameters, your blood investigations and all your x-rays have to be in normal values. And you have, everything has to be in control. Even if you are a diabetic, you have to be in a controlled diabetic stage. And if you are a hypertensive, you should be on proper medication and it should be under control. Then, yes, it is possible to do the procedure. If your blood investigations or your medical history is not so good, then we have to wait. You have to take the necessary precautions to bring everything under control, and then you can get your procedure done.
Okay. So anything else is a daycare procedure, am I right?
Yes, it's a daycare
procedure. Yeah,
procedure.
daycare procedure.
Yeah.
And what is the pre-op you suggest before operation?
Yes.
What are the things the patient should know or do?
Correct. So number one, when the patient steps in, we have to sit and talk to the patient. You have to counsel the patient, which we Z team believe very strongly.
Yeah.
We have to understand what the patient needs and what is his expectations, and will we be able to fulfill all their expectations. We have to sit and have a detailed talk. So once that is over, we can roughly give them a hairline, tell them this is how, give them an idea how it is going to look, how the procedure is going to be and everything. So once that is done, They have a set of blood investigations and x-rays and everything they have to take, sir. So once all the investigations are taken, we have a group of doctors. We have an anesthetist, we have a general medicine doctor. We'll discuss with them, we'll show all the reports. So once all the reports are fine and the patient's even the medical issues are under control, then we'll proceed with the plan or procedure. And this hair transplant procedure is not done under general anesthesia where the patient will be unconscious. It's done under local anesthesia where the patient will be very much awake. They will be taking breaks. They can have a lunch break. They can drink water. They'll be very much awake, sir. That's why I call it a very simple procedure. All the patient needs to do is they should have some patience to attain a good result. That's all.
Okay. When they can take bath or after the surgery, it take normally around 5 to 6 hours?
Yes, sir.
It depends actually.
Yes.
Sometimes more you do in stages.
Yes.
So after that, what they supposed to do? After once you have finished the surgery, what are the common instruction you give to the patient? They can go home the day itself?
Yeah, they can very much go home. Okay. We'd always recommend somebody to accompany them just to be in the safer hand.
Okay.
And they'll usually feel little heavy-headed that one day, but post medications they'll feel very comfortable. So another 1 week the patient has to do some saline irrigation to the surgical area, and then they have to clean the donor area, apply some medications. But in our clinic, what we usually do, which the others don't usually follow, is that we call them almost every day.
Oh, is it? Okay, good.
Because we are concerned they shouldn't, they should not be scared to clean it properly, or that might lead to some infection. So we always call the patient every single day after the procedure. Maybe one day we give them a break to take rest and all that. From the day 2, we call them every day. We remove their dressing, we clean it, we take pictures, show them how it is healing. So almost the healing period will take about 7 days. Then 8th day we again call them. We give them a shampoo wash to make sure the grafts are stable, to see how it is healed, and then we give them a hair wash. It's 8th day we give them a hair wash. After that they are good to be on their own.
When they'll have a normal hair growth, is it like normal hair after you are done? You completely shave the head, am I right?
Yes, we completely shave off the head, provided some patients, they would ask for no trim. Say, we have done for a lot of, movie stars and celebrities. So they ask not to trim the hair, the profession is demanding that. So for them, yes, of course, it is always good to shave the hair to avoid any infections. But yes, some certain cases we do without trimming, but we take a lot of, double the precautions for those patients, sir.
So it will take like a normal hair growth.
Yes.
When they look like maybe it takes 1 or 2 months.
The change they are asking. Okay. So it's a very good question, sir, because one thing is that once the hair is implanted, towards the end of 1 month, all the hair will shed. They will see some hair growth in the 10th to 11th day, but the hair will shed in at the end of 1 to 1.5 months. It is just the hair that is shedding, not the roots that we have placed.
Okay.
So the hair will shed. So towards the end of 3 months, it will start growing. Around 7 to 8 months, they will be able to see 85 to 90% of the result.
So 7 to 8 months.
Yes.
Okay. So extremely thankful. Any other question will come back later.
Sure, sir.
And thank you very much for Dr. Priyanka. I remember it's started by my beloved son, Dr. Sethu. He always used to say the highest quality.
Yes.
We believe. And his classmate, Dr. Jengit, is also very close associate.
Yes, he is our leading hair
transplantation from Delhi. He comes and we have a consultation. I'm also into the team.
Correct.
Just for motivation and all that. But since basically I'm fully into gynecology, only counseling part little bit I take, but I cannot do the procedure. I'm just be in the team.
Correct.
So anyway, very happy for all the patients who are seeing, and anybody have any doubt, always you are welcome.
Yeah.
Because the patient has to be clarified.
Correct.
The doubt has to be clarified. So we thank very much for Dr. Priyanka and the people who are watching it. Thank you very much.